Okay, so you get hit with that sharp, radiating pain, and then the doctor says those words, you have a kidney stone. Your mind just starts racing, right? What does this actually mean? What's going to happen next? Don't worry, we're going to break down everything you need to know step by step.
So this is the big one, right? It's the first question that pops into your head, and honestly, it's the most important one. Knowing the difference between, okay, I can manage this at home and I need to get to the ER, like right now, is absolutely crucial. To make this all super clear, let's just walk through a really common scenario. Imagine a patient comes in with that classic, awful flank pain. An ultrasound finds a 4 mm stone in their proximal ureter. That just means it's in the top part of the tube, right near the kidney. We're going to follow their journey to see exactly how a doctor thinks through this whole situation.
All right, first things first, we gotta understand the basic layout of the land. The easiest way to think about your urinary tract is like a plumbing system, and that kidney stone, well, that's a potential clog.
And the star of the show here, or maybe the villain, is the ureter. It's this long, skinny tube that carries urine from your kidney all the way down to your bladder. The second a kidney stone decides to leave home, leave the kidney, and enter this tiny tube, that's when the trouble usually kicks off. It's a simple idea, but it's really the root of the whole problem.
So how do we decide if this clog is just a minor inconvenience or a full-blown 5-alarm emergency? Well, it really just boils down to 3 key things that doctors are looking at.
The first factor is location, and this is a huge one. You see a stone that's just kind of chilling inside the kidney itself? That's usually not what's causing that sharp, acute pain. But the moment it moves into that narrow little ureter, it becomes an active stone. It's on the move, and it demands our full attention and respect. Next up, we've got size. And yeah, as you can probably guess, this makes a world of difference. It's the single biggest predictor of whether that stone can actually make it all the way out on its own. The odds change like crazy based on just a few millimeters.
And this chart just lays it all out perfectly. You see stones that are smaller than 5 mm, they have a really good chance of passing by themselves. But once you get into that 6 to 9 mm zone, the odds drop off. And if you've got a stone that's 10 mm or bigger, yeah, it's pretty unlikely it's going to pass without some help. That 5 mm mark is a real tipping point.
And finally, we look at the clinical features. This is all about what your body is telling you. Think of these as the bright red warning lights on your car's dashboard, the true danger signs that tell us we've got a serious problem on our hands.
Now, here's what you really need to pay attention to. Pain you can't control, or severe nausea and vomiting, those are serious. But, and listen closely here, the absolute #1 sign that you need to go to the emergency room, no questions asked, is a fever. A fever plus a blocking stone is a true medical emergency. It means there's an infection brewing behind that clog, and it has no way to get out.
Okay, so we know the factors. We know what to look for. Now, how do doctors actually get all this information? This is what we call the workup, where they use imaging to get a really good look at exactly what's going on. The 2 main tools in the toolbox are the ultrasound and the CT scan. The ultrasound is great. It's easy to get, there's no radiation, and it's fantastic for seeing if the kidney is swollen up from the blockage. But it's got one surprising little catch when it comes to size. The CT scan, on the other hand, that's the gold standard. It'll give you the exact size, the exact location, but it comes with a dose of radiation and a bigger price tag. Okay, but get this. This is a wild and super important detail. It turns out that because of how the technology works, an ultrasound isn't perfectly accurate for measuring stones. In fact, it tends to make stones look bigger than they really are, by about 2 mm on average. So what does that mean for our patient? Remember that 4 mm stone they found on the ultrasound? Well, if we do the math, that stone is probably only about 2 mm in reality. And if you think back to that chart, a 2 mm stone has an incredibly high chance of passing all on its own. This one little fact completely changes how we look at their case. So, since our patient has what's likely a very small stone, and they have 0 of those emergency danger signs, the game plan is something called a trial of passage. It's basically a fancy way of saying we're going to try and let you pass this thing at home and hopefully avoid a procedure altogether. So what's in the playbook for this home plan? It's pretty straightforward, with 4 key parts. First, a medication, like tamsulosin, which can help relax the ureters and make more room for the stone to get through. Second, good pain relief is key. Third, you gotta stay hydrated to keep everything flowing. And fourth, and this is so important, you have to know exactly what those emergency signs are, especially watching out for a fever. Now, you might be thinking, wait, I've heard some chatter about that tamsulosin stuff, whether it actually works. And you're right.
There was a big study in 2018 that looked at really small stones, around 4 millimeters, and it found that the medicine didn't really seem to help much more than a sugar pill.
But that's not the end of the story. Not even close. When you zoom out and look at a massive review of almost 70 different studies, we're talking 10,000 patients here, it found that tamsulosin is effective, and it's especially helpful for those slightly larger stones. So because it's super safe and there's a good chance it could help, most doctors still prescribe it.
Okay, let's fast forward. The pain is gone, you feel amazing. You think it's over, right? This is where a lot of people make a really common and really dangerous mistake. Just because you feel better doesn't mean the story is over.
And just look at this number. This is what's so wild. One study found that for over a quarter of patients, that's 26%, the pain totally went away. But the stone was still stuck in there, blocking their ureter. The pain is gone, but the clog is not, and that can quietly cause damage to the kidney over time.
So what's the bottom line here? It's simple, and it's non-negotiable. Even if you feel 100% better, even if you think you saw the stone in the toilet, you absolutely must get follow-up imaging, like another X-ray or ultrasound, to prove that the blockage is gone and the stone is out. It is a critical safety step.
And with that, our patient is officially in the clear, for now. They've figured out the problem, managed it safely at home, and confirmed it's truly resolved. But of course, that just leaves us with the biggest question of all. How do you stop this from ever happening again? And that, my friends, is a whole other explainer.